I'm Ewa Panetta, manager at the MHA Keystone Center. The Michigan Health and Hospital Association is committed to supporting its member hospitals to ensure that every person in every community receives high quality, equitable, and safe care. I've had the great honor and pleasure of being part of the team to launch this important work, which holds a special place in my heart due to personal experiences as an immigrant to this beautiful country, navigating the complex healthcare system while supporting my parents. This instructional video is a second video in a series which is intended for teams assigned to complete the Health Equity Organizational Assessment. As a recap, our introductory video served as a call to action, encouraging all MHA member Chief Executive Officers to sign the MHA Pledge to address racism and health inequities as a unified commitment to addressing disparities, dismantling institutional racism, and achieving health equity. During the introductory video, teams were also introduced to the MHA Health Equity public website, which features information and resources, including the comprehensive guide, Eliminating Disparities to Advance Health Equity and Improve Quality, which was developed with the goal of supporting your organization's health equity efforts. Teams were also introduced to the Health Equity Organizational Assessment, an evaluation tool that assesses your organization's current activities around 7 key categories identified through national research as critical components of organizations' ability to not only identify, but as well as address disparities. We invite you to join us on this important journey and take action by signing the MHA Health Equity Pledge and by completing the Health Equity Organizational Assessment to identify key next steps and actions your organizations can take to address disparities in care. As mentioned, this instructional video is a second video in a series, and it is for teams who are assigned to complete the Health Equity Organizational Assessment to ensure that it is conducted in a standard way across our state so that we at MHA Keystone Center can utilize the information and data to identify opportunities and to address gaps through resource identification and by providing educational opportunities to our members. The first step is to ensure that your organization has access to our data platform, KeyMetrics, where the Health Equity Organizational Assessment is housed. Some of you may be familiar with the KeyMetrics system, which serves as our data collection and reporting tool for the MHA Keystone Center quality activities. But if you are new to the MHA Keystone Center, let us show you how to request access.
As already mentioned, the public MHA Keystone Center Health Disparities website, found under the MHA.org, features key information and resources related to this important work. This includes the Health Equity Pledge, the Health Equity Resource Guide, which we covered earlier, along with Health Equity Organizational Assessment information. If you click on the tab here and scroll to the bottom, you will see a KeyMetrics link. For the purposes of this video, as a new user, you will click on the Request Access link found on the bottom here. Next, you will enter a preferred email address and click Next. The system will now bring you up for additional prompts that you will need to fill out to process the access request. This includes your first name, your last name, again, your email, which is already populated here, as well as setting up a password. We strongly recommend that you use a phrase password. You are now going to select the managing organization, which is the MHA Keystone Center. You will then select any applicable projects you need access to. So you will see the KeyMetrics houses a variety of projects currently for the MHA Keystone Center. You can hover over the information icon here, which will show you a little information about the project that you are hoping to request access to. For our purposes today, as a new user, you will request information under the Quality project, which houses a variety of different projects under the MHA Keystone Center. As you look down the prompt list, you will now specify which system or facility you need access to within the KeyMetrics system, along with your title and your phone number. The KeyMetrics system has what is referred to as a two-factor authentication. So after your account has been approved, when you go in to log in after entering your password, you will be prompted to enter a code. During this request access process, you can select how you'd like to receive this code moving forward, either via email or a text. Please select your preference here. After all the information has been selected, you will click Next to finalize the request access process. After submitting your request, you will receive an email from the system confirming the administrator has approved your account and you're ready to log in to the KeyMetrics system, where you will find the Health Equity Organizational Assessment.
And that covers the first critical step, gaining access to the KeyMetrics system to utilize and view the Health Equity Organizational Assessment. Next, you will hear from my colleague, Josh, who will dive deeper into the Health Equity Organizational Assessment and how to complete it.
Thank you for that great presentation, Eva. Hello, my name is Josh Suire, and I'm the Senior Manager of Safety and Quality here at the MHA Keystone Center. So now that you have access into our data system, KeyMetrics, I'm going to show you how to complete the Health Equity Organizational Assessment, or HEOA. Even if you already completed the assessment in 2019 or 2020, we ask that the person completing the assessment in 2021 watch this video so that we are answering the questions in a standardized way across the state. Okay, so let's dive right in.
As Eva had mentioned, the MHA Keystone Center's Health Disparities webpage is the one-stop shop for you to gain access to a multitude of tools that you can use to advance health equity in your organization. One such tool is the MHA Keystone Center Health Equity Guide on eliminating disparities to advance health equity and improve quality, which can be downloaded here. The purpose of this resource is to provide practical guidance for organizations that are seeking to eliminate disparities in care to advance health equity. Near the end of the guide, you will see the 7 levels of implementation. These 7 categories have been identified by national research as critical components of an organization's ability to identify and address disparities. Each question in the HEOA was created to gain an understanding of your organization's current state in each of these 7 categories and provide tangible next steps to advance health equity. We will focus more on these 7 levels as well as action planning in our next video installment. But to provide a visual of how the categories are aligned with the questions in the HEOA, a slide of each level will be presented. When looking at the vast amount of information in these categories, it is crucial to acknowledge that one person likely will not be able to answer all these questions. It is recommended that you assemble a team of experts who will be able to assist you in gathering organizational information, as well as validating the accuracy and completeness of the questions asked in the assessment. We will now log back into KeyMetrics to complete the HEOA. To do so, scroll down to the Health Equity Organizational Assessment tab and click on the attached hyperlink for KeyMetrics. At this point, you may receive a 2-factor authentication request. Simply insert the code that is sent to your phone or email address and log in. The website always opens on the surveys page, and this is where you're going to see access to any survey that is available to your organization. In this case today, I'm going to go ahead and filter down to Mitten Medical, which we will use as a test organization. The project will be Quality, which is where the HEOA is housed. The survey will be the Health Equity Organizational Assessment, and we will leave the data status filter to all and perform our search. Now click on your facility and we can see a couple of items regarding the survey. You'll see that the 2021 survey is in an incomplete or unlocked status, and only 5 of the 10 required fields have been completed here. Although there's a total of 15 potential questions in the HEOA, 10 are required. Now we will click Edit to complete or validate the 2021 assessment. If you have completed the assessment in 2019 or 2020, your previous answers will be carried forward to the next year. If you did not previously complete the assessment or questions were left unanswered, they will be blank. In the event that you change a response, and then you want to revert it back to your previously filed selection, you hit Copy from last period. It is important to note that this is an annual survey that is designed to be a working document that should be updated quarterly. You will receive communication of quarterly dates in which we will recommend you update your answers to measure quarterly progress. Lastly, the official lock date will be December 31st of each year when the responses are permanently filed for you. So let's review the first question in the assessment, which is, does your hospital use a self-reporting methodology to collect demographic data from the patient and/or caregiver? Collecting patient demographic data on at least 95% of patients served is a best practice that helps hospitals and healthcare systems to understand their patient populations and measure patient outcomes to ensure health equity. In addition, identifying the unique needs of each individual gives the multidisciplinary team information that they need to provide a person-centric approach to care. Now, this is a select all that apply question, and we have 4 choices. First, real data consists of race, ethnicity, and language status. In the future, other demographic information such as age may be added, but for 2021, we will focus on these 3 areas. Next, SOGI data focuses on assessing each person's sexual orientation and gender identity. Third, screening for social determinants of health, such as access to housing, food, healthcare, etc. And the last selection, none of the above, indicates that an organization is not collecting at least 95% of patient data in any of the prior 3 categories. The second question is a skip logic question and will only appear if you selected real data in question 1. This question is, does your hospital collect real data for at least 95% of patients with the opportunity for verification at multiple points of care, beyond just registration, to ensure the accuracy of the data and to prevent any missed opportunities for data collection? Organizations should consider developing protocols outlining a standard approach to obtaining patients' real data when the unknown or unavailable categories are selected for patients upon initial registration. Some example of these points of care include pre-registration and the admission process on inpatient units. In answering these first 2 questions, it may be appropriate to include your organization's registration experts. They will likely be able to help you to identify what fields exist in the registration process. For more information on regulatory standards and best practices for data collection, please refer to the resource compendium at the end of the Health Equity Guide. We will now move into the topic of data collection training. Question 3 asks, does your hospital provide workforce training regarding the collection of patient self-reported data? This typically is referring to the training of registration professionals, but could be expanded into other roles that may collect demographic data, such as nurses completing the clinical admission process. The next 2 questions are again skip logic questions and will appear only if you selected yes to question number 3, which we have. In question 4, you will select any of the 3 data sets that are included in your workforce training, or none of the above if that is the case. Question 5 asks, does your hospital evaluate the effectiveness of workforce training on an annual basis to ensure staff demonstrates competency in patient self-reporting data collection methodology? This could include activities such as role-playing, direct observations, utilizing teach-back methods, or engaging in post-education training. Next, question number 6 begins assessing your data validation processes and asks, does your hospital have a standardized process in place to verify the accuracy and completeness, such as percent of fields completed, of patient demographic data? Now, this is alluding to your ability to assess the total percentage of patients in which the demographic fields were completed. It is also important to include the percentage of patients in which unknown, unavailable, or declined was selected with the cumulative goal of less than 5% of total patients. Again, it may be appropriate to include your registration experts in performing this analysis, or even an IT specialist who may have the capability to run a report on these specific fields. Question 8 asks, does your hospital have a standardized process in place to evaluate and compare hospital-collected patient demographic data to local demographic community data? Now, this is speaking to whether your organization compares internal demographic data to external community data to validate whether or not your patient population appears to match your community. This could be done using results from sources such as the most recent U.S. Census results or results from a recent community health needs assessment. Question 9 is another skip logic question and will only appear if you answered yes to question number 8. This is asking you to provide any of the 3 data sets that your hospital is evaluating and comparing to local demographic community data. Next, question 10 asks, does your hospital have a standard process in place to address any system-level issues to improve the collection of self-reported patient demographic data? In answering this question, you are assessing if your organization engages in process improvement efforts to consistently improve on collecting and validating any of the 3 data sets. This could look like an internal team that monitors internal performance related to patient demographic data and engages in continuous process improvement. Now we are moving into the data stratification section of this assessment. Here we are examining safety, quality, or outcome measures with an equity lens to determine if differences in patient outcomes exist and identify areas in need of quality improvement. For question number 11, you will select the dropdown that best describes the activities your hospital engages in to stratify patient demographic data. The first selection indicates that at least one patient safety, quality, or outcome measure is stratified using real data. An example of this could be that you analyze mortality rates by race. The second selection indicates that you stratify more than one of these measures utilizing real data. And the third selection is the most advanced and indicates that you stratify more than one measure using real data as well as demographic information such as sexual orientation, gender identity, and social determinants of health. And the last selection is none of the above. We will now move on to how findings may be communicated in your organization. All of the previous sections we have reviewed in the HEOA are strictly related to data collection, training, validation, and stratification. The rest of the survey focuses on assessing organizational culture and internal processes to see where the opportunities are for clinical performance improvement. Question 12 asks, does your hospital use a reporting mechanism, such as an equity dashboard, to routinely communicate outcomes for various patient populations? This is assessing if a regular reporting mechanism is in place that leadership can visually assess for potential differences in patient outcomes. This may include equity dashboards, scorecards, or reports. If you select yes, question 13 will appear, which asks, with whom does your hospital communicate outcomes for patient populations? You will then select all that apply. Addressing and resolving gaps in care is really the why behind our work in addressing health disparities to advance health equity. Question 14 asks, what type of interventions does your hospital implement to resolve differences in patient outcomes? Again, the first three responses are select all that apply, but if your organization does not have any of these processes in place, you can simply click none of the above. Let's review a case example of how an organization might implement these three best practices. For example, Mitten Medical has identified that patients and families with a preferred language other than English have higher readmission rates when compared to the total population. In implementing the first intervention, a multidisciplinary team is formed to test pilot the use of in-person interpreters at the point of discharge for all patients and families with limited English proficiency. This is a 3-month test pilot, and readmission rates are monitored to assess the impact. At the end of the test pilot, a significant decrease in readmission rates for this population was identified. For the second intervention, due to the positive results, linguistic services were broadened, new policies and procedures were integrated into daily workflows, and staff were provided training on the new in-person interpretive procedures. The final intervention is speaking to sustainability. For this example, the hospital has developed a limited English proficiency dashboard that is monitored by case management. This dashboard provides real-time measurements of in-person interpretive service utilization rates as well as 30-day readmission rates. These patient outcome measures are reported to leadership on a monthly basis. Lastly, organizational infrastructure and culture places emphasis on health equity as a strategic goal. Although this is the final question in the HEOA, it is truly one of the first steps in an organization's journey to eliminating health disparities. Whether it is pledging to ensure equitable healthcare is prioritized and delivered to all, or designating a leader to oversee and progress health equity work, this category is a crucial element in achieving your goals. In answering question 15, you can work directly with your CEO and executive leadership team to identify which of these responses best captures your organization's current state in infrastructure and leadership. Okay, now that you've completed the assessment, you will check the 2021 HEOA data validation box to confirm your selections. If you completed the HEOA in 2019 or 2020 and all of your selections are the same, you will simply need to check this box to validate your answers and submit the survey. Again, this is an annual survey that is filed on December 31st of each year. We will send quarterly reminders for you to make any updates to this working document, which will allow you to measure quarter-over-quarter improvement. In our next video installment, we will review the HEOA dashboard, dive deeper into the 7 levels of implementation, and discuss action planning to achieve next steps in your health equity journey.
We thank you for taking time out of your day to watch this video on how to complete the Health Equity Organizational Assessment. If you have any questions on completing the assessment, please email us at keystone@mha.org. And please stay tuned for our 3rd video installment in the series on how to use the results of the HEOA to close gaps and build action plans.
I want to personally thank you for your commitment and dedication to this important work. We at the MHA are here to support you and partner with you on this important journey.